Well, good morning, everyone. The hearing will come to order. Today, we'll discuss a topic of bipartisan interest, promoting home safety for seniors, children, and people with disabilities, as well as families in general. This has been a long-standing priority of the Special Committee on Aging. In October of 2019, the committee released a bipartisan report on falls and held a hearing on this same topic. We know that a quarter of all older adults, 1/4, fall every year, and that the majority of these falls occur within the home. I witnessed the struggles that accompany a fall firsthand when my mother experienced a fall just December of 2021, early December. She's doing well now and recovered, but it was 2 long and difficult months between and among surgery and then rehabilitation and then returning home. So many families have had this experience. For some, a fall can be prevented by installing a grab bar in their home or making other modifications. But for others, it might be participating in, for example, evidence-based programs like a program called A Matter of Balance, which offers small group activities and exercise training. So investments in home modifications and prevention programs are a really small price to pay, considering that senior falls contribute to $50 billion. That's 50 with a B, $50 billion in medical costs per year. And unfortunately lead to 34,000 deaths among seniors. But in some cases, home modifications alone aren't enough. Every year, emergency rooms across the country treat over 22,000 preventable injuries caused by falling furniture, like dressers or television sets. Annually, over 3,000 of those injured by tip overs are older adults. But it's not only seniors, of course, who are harmed. Children are also put at great risk. And tragically, of those killed by furniture tip overs, 81% are children. My home state of Pennsylvania was touched by these devastating losses. We lost Katie Lambert and Curran Collins to these tip overs. Katie was 3 years old when she died due to injuries sustained from a furniture tip over in her family's home in Huntingdon Valley, Pennsylvania, just outside of Philadelphia. And Curran from Westchester, Pennsylvania, as well, close to the city of Philadelphia, outside of the city. Curran was, when he passed away, was only 2 years old. There's no reason for any family to endure this unspeakable loss. Compounding the grief and the loss for these families and what they experience is the fact that these deaths might have been prevented by stronger standards. And we'll talk more about this today. Mandatory stability standards would make our homes safer overall, but especially for children. I'm proud to lead a bipartisan bill, the STURDY Act, alongside Senators Klobuchar, Blumenthal, and Cotton. This act would require the Consumer Product Safety Commission to create a mandatory stability standard for furniture. It would require companies to ensure their products are tested for safety before that product is sold. It's a simple, common sense requirement that will save lives. So today we'll learn more about what Congress can do to keep our children, our seniors, and our families safer. So let me turn now to our ranking member for his opening remarks.
Thank you, Chairman Casey, for holding another truly important hearing. And thank you to each and every witness for investing your time, your energy, and frankly, your expertise on a topic that is so important to all Americans, but specifically our senior population. I remember one of my earliest goals in life was to make sure that my mother had a safe place to live with a garage. And so I spent a lot of time and energy trying to make sure that instead of living in apartments or as she did growing up in the projects, that she'd have an opportunity to own her own home, live in it, and feel the safety and the security that comes with home ownership. In addition to that, I wanted to make sure that not only did she have that opportunity, but so many others in communities that are too often living from paycheck to paycheck or living in marginalized communities, they would have that opportunity as well. Over half of public housing today, public housing residents, are seniors or people with disabilities, but less than 20% live in accessible units. All residents deserve the choice to have housing that meets their needs. So I'm working on a bill to give older Americans and those with disabilities the resources they need to leave their public housing units and find a home on the market if they want. Also releasing a report, Housing for, this is the report here, Housing for the Golden Years, that explores senior housing needs and what we can do to help seniors meet those needs that they have in a way that shows dignity and respect for our seniors during their golden years. South Carolina is one of the most popular retirement destinations in the country. I'm sure that it will continue to grow in its popularity. But seniors in our state still face an uphill climb in so many ways as it relates to housing. We want to find ways to bridge that gap. I'm inspired by the efforts to help older Americans in my home state of South Carolina. A group called Homes of Hope in Greenville builds affordable houses for working people in need. They strive to integrate seniors and people with disabilities into communities with younger adults so they can also help support each other. Daniel Holloway was his family's primary earner until he unfortunately developed kidney failure. And because of that, he could no longer afford the place that he was living. So you can imagine the breadwinner supporting a family no longer being able to do so. Thankfully for him, Homes of Hope, they were able to step in to help him out during the challenging times that he went through. The good news is that he was able to see his health improve. And as his health improved, he was able to once again take on the responsibilities of caring for his family and providing the resources necessary for his home. Thank God there was an organization, however, that was there during the most challenging and difficult times of his adult life. There needs to be more organizations like the Homes of Hope in Greenville that help support our older Americans. For older Americans and people with disabilities, falls are one of the largest threats in the home. Over 30,000 folks, somewhere around 36,000 falls a year, are seniors and people with disability experience every single year. Home modifications can help prevent this from happening. And so the focus on making sure that homes are equipped with the necessary support systems is so vitally important for longevity and health. I am so thankful that the chairman's mother was able to overcome the fall. And Chairman Bob, I'm so thankful that she is doing well and seems like her recovery has been complete. That is a blessing, and it's good to hear, Chairman Casey. For example, in Charleston, South Carolina, we are now building something called the Granny Flats, which allows for people to use a part of their property to build a place accommodating their seniors, typically their parents or their grandparents, on their property. This actually adds more stock to a very scarce resource, which of course are the homes that people can live in. And so I'm looking forward to seeing more innovation and more creativity in the marketplace so that we can take advantage of the opportunity to love and to care for our family members on our own property. In addition to that, opportunity zones that we passed just a few years ago now provides another opportunity for the utilization of real estate in a cost-effective way to provide more senior housing. And the fact is that in just 2019, we saw nearly $30 billion invested in opportunity zones in America. That is a great opportunity for us to provide senior housing at a lower price point, and something that I look forward to discussing throughout this hearing. Thank you so much, Chairman Casey, for holding this hearing. I look forward to hearing the testimonies of our witnesses.
Ranking Member Scott, thank you for your opening statement. And I want our folks listening or watching this hearing today, as well as our witnesses, to know that we'll have various senators in and out. It's a day when senators have other hearings or other commitments, so they're in and out. But I know earlier, and you might still be with us, we were joined by Senator Rick Scott. And so as we go, we'll try to weave in senators and their questions when they're available. But I wanted to start with our witness introductions. I'll do the first one, then I'll turn to Ranking Member Scott to introduce our second witness. But our first witness is Dr. Anand Parake, who's the Chief Medical Advisor of the Bipartisan Policy Center. Dr. Parake is a board-certified internal medicine physician. Prior to joining the Bipartisan Policy Center, he served as Deputy Assistant Secretary in the Department of Health and Human Services in the Senior Executive Service at the department from 2008 to 2015. Dr. Parake will share his medical and public health expertise today on topics of home safety and unintentional injury prevention. Ranking Member Scott?
Thank you, Chairman Casey. It's my privilege to introduce today Ms. Denise Cleveland Leget. She is the Senior Vice President of Business Development for Integral, an Atlanta real estate development organization. Integral is an innovative enterprise helping connect people to the American dream, as well as focusing some of the time that she has and her expertise on seniors reaching their American dream too. So I'm really excited to have her with us today. Ms. Cleveland Leget previously served as a Southeast Region Administrator for the Department of HUD and managed over 800 employees while overseeing programs throughout South Carolina and 11 states. She has wide-range insights into housing policy at every level, from the federal government to on-the-ground needs and how our policies impact real estate. She has also been widely recognized for the many talents and gifts she brings to the community. She received in 2021 the Women of Influence Award and the Justice Robert Benham Award for exemplary and unparalleled community service, recognized in Who's Who in Black Atlanta. Under her thoughtful and dedicated guidance, HUD was able to better meet the housing needs of seniors and people with disabilities across the entire region, including the Palmetto State. We look forward to hearing your testimony, and thank you for investing your time in this hearing.
Thank you, Ranking Member Scott. Our third witness today is Ms. Tracy Kelly, who's Director of Corporate Communications and Public Affairs for Ikea USA. Ms. Kelly leads Ikea's Safer Life at Home initiative, focusing on development and innovation related to product safety. I must acknowledge Ms. Kelly's Pennsylvania connection. She graduated from Penn State University and currently lives in Trapp, Pennsylvania. She will testify to Ikea's work in support of initiatives to increase home safety. Our fourth and final witness today is Ms. Janet McGee. Janet is joining us from St. Paul, Minnesota. She is the Director of Parents Against Tipovers, a nationwide network of parents founded in 2018 to advocate for an end to furniture tipovers. Ms. McGee's testimony will shed light on the urgent need to pass the Sturdy Act to make our children and our homes safer. So now we'll turn to our witnesses for their statements, and I'll just call on each witness in the order we introduced them. And I'll start with Dr. Parake.
Chairman Casey, Ranking Member Scott, and members of the committee, thank you for the opportunity to appear before you. I applaud the committee for hosting this hearing this morning to shine a light on preventable harm to vulnerable Americans in the home setting. My testimony today is based on my perspective as a physician, former public servant, and currently Chief Medical Advisor at the Bipartisan Policy Center, where I, along with my colleagues, have spent the last several years concentrating on the intersection between housing and health. I have concluded, based on my experience, that housing is health, given the significant evidence that housing affordability neighborhood conditions, and conditions within the home impact health outcomes. With respect to the safety and accessibility of the home setting, I'd like to start out by recognizing that this is an important issue across the lifespan, from childhood to old age, and thus I appreciate the committee's broad focus today. That being said, I will concentrate my testimony on the older adult population. BPC's past report, Healthy Aging Begins at Home, noted that while virtually all seniors would like to stay in their homes for as long as possible, only 1% of homes today have the 5 universal design features necessary to make them accessible for those with impaired mobility. No step entries, single floor living, accessible electrical controls and switches, extra wide doorways and halls, and lever style door and faucet handles. This is despite 38% of households 65 and older having at least one person living with a disability. The reason that home modifications are so important is they, as the chairman said, contribute to reductions of tragic events such as falls. Each year, millions of Americans over the age of 65, more than 1 out of 4, experience a fall. Tens of thousands of adults die from falls each year, making it the leading cause of injury-related death in older adults. The estimated medical costs attributable to fatal and non-fatal falls is approximately $50 billion. In sum, most falls happen in the home, and most falls are preventable. In spite of this, there are no comprehensive programs or policies currently in place across the federal government to tackle this public health challenge. Given these findings, I offer 2 recommendations of the committee on how the federal government can be a better partner to states, localities, families, and individuals in reducing older adult injuries in the home setting. First, the administration should better coordinate federal home modification programs to maximize their impact. Given that multiple departments such as HUD, HHS, USDA, the VA, the Department of Energy have a role across the executive branch, the White House should take the lead and create a new interdepartmental home modifications task force. In recent years, Congress has authorized home modification grants through HUD and directed GAO to conduct a study of federal programs which support home assessments and modifications for older individuals and individuals with disabilities. In addition, the Administration for Community Living at HHS awarded a grant to the University of Southern California to create and implement a home modification information network, an online searchable database of home modification tools and resources. All of these actions align with or were recommended in BPC's previous report, and we are pleased to see recent progress to date. That being said, it will be incumbent upon Congress and the administration to act on the GAO's upcoming findings, as well as take stock of the work done to date to ensure that federal home modification initiatives are coordinated and yielding maximum impact. An analysis of these discretionary programs should also be coupled with a review of how public insurance programs, such as Medicare and Medicaid, are covering home modifications. Finally, a new national partnership with states, localities, the National Aging Network, and private sector entities offering modification services should also be launched. Second, the U.S. Department of Health and Human Services should make falls prevention a top departmental priority. A coordinated action plan should be developed to catalyze research, surveillance, implementation of evidence-based programs, and the delivery and financing of proven interventions. This will require building on existing evidence-based falls prevention programs and necessitate strengthened partnership between agencies such as ACL, CDC, NIH, and CMS. The plan should also include a public awareness component and could build upon the CDC's Still Going Strong campaign and the National Council on Aging's National Falls Prevention Resource Center. In addition to facilitating home modifications, there are a number of key actions that should be taken, many of which will require leadership from CMS. First, CMS should require that CDC's STEADY falls prevention screening tool, which assesses for difficulty with walking, balance, or vision, and reviews medication lists, is used by providers conducting an annual wellness visit for Medicare beneficiaries. Second, CMS should also include the number of falls-related admissions, as opposed to simply the number of patients screened, as a quality measure for alternative payment models and Medicare Advantage plans. This will further incentivize healthcare entities to focus on falls prevention. And third, Medicare and Medicaid should identify ways to scale evidence-based community falls prevention programs, such as the Capable model and a Matter of Balance through new or existing alternative payment models or the Medicare Advantage program. In conclusion, thank you for your leadership in addressing these issues, and I look forward to your questions.
Doctor, thanks very much. And before turning to our second witness, I want to acknowledge Senator Blumenthal has joined our hearing. We're grateful for his presence. Our next witness, our second witness will be Ms. Cleveland Leget.
Good morning, Chairman Casey and Ranking Member Scott and other members of the Special Committee on Aging. Thank you for the introduction, Senator Scott. I am very proud and happy to be with you today. I'm happy to be with you for a number of reasons, one of which I lost in December of 21, my 94-year-old mother. She lived a life of dignity. Like many people, she met and married the love of her life. He unfortunately passed in 2007. And after that, we had to make a decision. My father wanted my mother to live in her house as long as she was able to. And but as many people face, failing health makes you have to make changes and makes you make decisions as to where your parents go. And so we had to make a decision. We were fortunate as a family to provide her with fantastic living arrangements until her death. And so as we stood around her casket, my siblings and I held hands and we said, we did Mom proud. She would have been happy the way that we allowed her to live out her life with dignity. Unfortunately, there are many Americans who don't have that privilege, who don't have the opportunity, not from any fault of their own, not from any mistakes that they made, because life happens sometimes unfairly, but life happens and doesn't give you the options and the choices that you would want to make for your loved ones. I want to tell you a little bit about my company, Integral. Integral was founded in 1993 by a gentleman by the name of Egbert Perry. And the thing that is so amazing about Integral is that it's a company that, it's a development company, but it's one that pushes changing the trajectory in the lives of people, not just pretty houses, but it's built to make things better and change the lives of the individuals that they serve. And what they did in 1993 was unparalleled. There was in this country, many people who lived in the cities, there was concentrated poverty, and people didn't know really what to do. And so the innovation and working with the Housing Authority Director, Renee Glover, they worked to build public-private partnerships that would change people, change the lives so that you now have the public sector and the private sector working together to make a change. With that change, they created something called the Atlanta model. And that Atlanta model is a community development strategy, incorporates multiple public-private partnerships to deliver several elements to planned communities. And it was such an amazing feat that then Secretary Cisneros took the Atlanta model and codified it into HUD's programs and pushed it out to over 3,400 housing authorities for them to implement. At HUD, I was able to see tremendous work that had come about, not just from the Atlanta model, but for things like the opportunity zones. A nonpartisan joint committee on taxation found 42.4% of 24 billion invested in opportunity zone funds went to low income housing and developments in communities in 2019. I also was able to see the benefits of choice neighborhoods and what that funding does. It changes the lives of people. I've gone from house to house, and the opportunities that I've had with seniors who've come up to me, given me a hug and said, thank you, I never thought that this was possible. I never thought these living conditions were possible. They showed me their kitchens where They now can walk in because the kitchens were made appropriate. They had hallways that were wide enough to get a wheelchair through. They had showers that were did not have barriers for them to get in and out of. And so we saw a number of different amazing things happen while I was at HUD. But despite all of that and the things that were accomplished, 70 billion in backlog repairs still exist in most public housing units. Much of the public infrastructure is more than 80 years old and has been utilized for decades and was weathered many years of normal wear and tear with fluctuating levels of funding for maintenance and rehabilitation. Only 20% of housing units are accessible to persons who use walkers, canes, and wheelchairs. We are on a collision course with reality. In 1950, much of the nation's current public housing stock was constructed. Only 8% of the US population was 65 or older. By 2019, the number more than doubled to 16.5%. By 2050, the population over the age of 65 is expected to be at least 22%. In the next 30 years, 1 in 5 Americans will be a senior citizen, and a significant portion of them will be on fixed incomes. Some estimates calculate 55 or 53% of all of today's public housing residents are either elderly or disabled. It's becoming increasingly apparent that our nation's public housing asset, as fragile as it is, has become one of the nation's largest senior housing programs, catering to the market niche of low-income housing. I am speaking of the many teachers, clerks, mechanics, and others who find themselves in their communities and their governments, their tax dollars to support them when they retire. Many of them, as I said earlier, this is nothing due to any negative things that they did or they didn't do. There are so many things such as health, loss of job, loss of income, lower income that allows these circumstances to overtake our seniors. And it is up to us to make a difference. Other older adults are looking for safe homes on private market where onerous zoning regulations sometimes prevent that housing from occurring. For seniors on fixed incomes looking to age in place, these regulations can leave them with too few options. I believe that these individuals look to us, to look to you as their legislators, look to us who participate today as their voice. We're the voice of the voiceless. We are the voice of those people who need assistance. And there are many mechanisms that we can utilize to make things better. Working together collectively, public, private partnerships can make a difference, can make a change, which I've seen through my time at HUD and now in the private sector. And I believe that we, again, have to be the voice of the voiceless. Thank you very much.
Thank you, Ms. Cleveland Leget, for your testimony. We'll turn next to Ms. Kelly.
Thank you, Chairman Casey, Ranking Member Scott, and the Senate Special Committee on Aging for inviting Ikea to join in this important conversation. We share your commitment to creating a safer home for everyone, especially the most vulnerable, young children and seniors. That's why we support the Sturdy Act. This legislation will decrease the risk of furniture-related tip-over incidents and make homes safer by strengthening safety standards for clothing storage units. And it will accomplish 2 important objectives. First, it encourages industry to invest in research and the development of furniture safety innovations, and it ensures that safety and testing standards can be adapted to incorporate such innovations in the future. That's a vital component of a comprehensive approach to reduce the risk of tip over. Second, Sturdy provides a rulemaking process that is proven to produce final rules at the Consumer Product Safety Commission without delay. By avoiding delays of 2 years or more, brands like Ikea will be able to introduce new safety innovations and bring new products to market with confidence. In short, the Sturdy Act promotes innovation and regulatory clarity. This will be good for families, parents, children, and seniors. This will be good for business, for our business and for other businesses, and most importantly, this will be good for safety. IKEA has been engaged in the prevention of furniture tip over for years. This is not just an issue for IKEA, it is an industry-wide issue, it's a worldwide issue, and it's an issue for all ages. When we look at furniture-related accidents across all age groups, more children tragically lose their lives. But as it was mentioned before, far too many people age 60 and over also fatally are injured by falling furniture and appliances. From 2000 to 2019, seniors were the second largest age group who sustained fatal injury caused by tip-over accidents, 14% of all reported fatalities. A total of 3,200 seniors, an average of 60 a week, were seriously injured by tip-over accidents and required medical attention. At IKEA, we believe that everyone has the right to feel safe at home, from children to seniors and everyone in between. We're investing in research, innovation, product development, and testing for furniture stability. For us, as for so many others, our interests and our innovations are intensely personal. When one of our furniture designers was recovering from a debilitating stroke, she gained a new perspective on maintaining an independent life at home. Her life-altering event inspired our collection, Omtangsam. That's a mouthful, but it's Swedish for caring. The products in this collection are designed to help seniors remain in their homes and includes a beautiful wingback chair that would look great in any house. The hidden feature is in the design, as the chair makes it easier to both sit and to stand. Promoting safety is a big job, and none of us can do it alone. IKEA has a long history of collaborating with others on challenging topics. To introduce another Swedish word, our term for togetherness is kraftsamla. We collaborate with others on standard setting, solution development, and with Sturdy, advocating for important legislation. We are grateful for our partnership with organizations such as Parents Against Tip Over, Kids in Danger, and the Consumer Federation of America, who share the same goal to make homes safer. From our retail stores and website through to our social media channels, we regularly update and inform our customers on how we can help them reduce safety risks in the homes. During this pandemic, we have all been reminded that everyone deserves a home where they are safe and where their loved ones are safe. Let's work together to pass the Sturdy Act, and let's continue to work together to create a safer home for everyone, from children to seniors. Thank you for your time today and for bringing us together around this important topic.
Ms. Kelly, thanks for your testimony, and we'll turn now to our fourth and final witness, Janet McGee. Ms. McGee, you may begin.
Chairman Casey, Ranking Member Scott, and members of the Special Committee on Aging, thank you for allowing me to share my story with you today. My name is Janet McGee, and I'm a mom from Minnesota. When I was 20 years old, I graduated from the University of Minnesota with my degree in mortuary science. I served families for many years as a mortician. You might imagine the schedule of night calls, embalmings, night and weekend funerals. When the call schedule became too much for me, a single mom at the time, I decided to change careers to create a more consistent and stable lifestyle for my son. I started working at a Fortune 500 company, worked my way through attaining my MBA, and grew a whole new career. By 2016, I finally had what I had always wanted: a stable career, a balanced life, a husband, and a precious new child, Ted, who was born in 2014. Life was finally good. On Sunday, February 14th, 2016, I put Teddy down for a nap while the rest of our family went about our quiet Sunday afternoon. I was checking on him every 15 to 20 minutes, waiting for him to finally fall asleep. When I didn't hear him after a while, I went into his room to confirm he had finally drifted off. What I saw next is something I cannot unsee. Ted wasn't in his bed, and the dresser in his bedroom had fallen forward. In a panic, I screamed for someone to call 911, somehow stood the dresser back up, and started digging through a pile of drawers and clothes. My dear 22-month-old son, Ted, was at the bottom of the pile. His face was purple, he had blood coming out of his nose and mouth, and his feet were starting to feel cold. I started CPR immediately, while my 11-year-old son, the one that I had worked so hard to create a better life for, ran into the room, saw Ted in this state, and called 911. Despite being near his room this whole time, I didn't hear his dresser fall, and I couldn't understand how this happened. The paramedics got Ted to the hospital, and while they found a faint heartbeat, there was simply nothing more that could be done. Ted died that day, about 4 hours after I found him, from what I came to know as a furniture tip-over incident. Being a former mortician, I put on his last diaper, I dressed him, I put on his Thomas the Train light-up shoes, and I placed him in his casket at the funeral home. His shoes would never light up again, and all I could think is that I should be planning his second birthday party, not his funeral. While I thought Ted's death was a completely isolated incident, I learned shortly after he died that he was not alone. His dresser didn't meet the safety standard for clothing storage units, and worse yet, it didn't have to because it's a voluntary standard. Thousands of children, adults, and seniors are sent to the ER every year from tip-over related incidents. And sadly, over 570 people have died from tip-overs in the last 2 decades. According to the Consumer Product Safety Commission, 82% of these fatalities were children and 14% were seniors. In 2018, I helped form a national parent coalition called Parents Against Tip-Overs, which is comprised of parents from across the nation who have all lost their children to tip-overs. Each one of us thought our child was the only one this had happened to, and each one of us learned shortly after their death that they weren't. While you are hearing my story today, I hope you can understand my voice is one of many. Today, I represent the parents out there who cannot bring themselves to speak publicly about their tip-over incident or have been shamed, sometimes publicly, by others to believe they are somehow responsible for their child's death. I represent all the parents out there who are now full-time caregivers for their children because of a brain trauma or loss of oxygen caused by a tip-over. And I represent adults who are helping care for their elderly parents due to medical issues stemming from a tip-over. While the ASTM F15.42 subcommittee that sets the safety standard for clothing storage units has been in existence for over 2 decades, very little has changed with the way these units are tested. The safety standard remains voluntary, not mandatory. The testing does not account for real-world use scenarios, such as multiple drawers being open at once or a unit being used on a carpeted surface. Additionally, it does not test for drawers being loaded with clothing and does not account for the dynamic force a child might put on a dresser while they yank out drawers to get dressed. So today, I come before you to ask for your support in passing the Sturdy Act. This piece of legislation would require these gaps between real-world use and current testing to be accounted for and would finally make the safety standard mandatory. It would give power back to the CPSC to do what it was designed to do, which is protect the public from unreasonable risks of injury or death associated with consumer products, especially when the standard-setting process has proven to be insufficient. We are on a race against the clock to get more stable clothing storage units on the market. Since my son died in 2016, 52 more people that we know of have been killed by a tip-over, and this unfortunately will continue to happen until clothing storage units can be designed inherently stable following the passage of the Sturdy Act. After years of hard work, all stakeholders are finally in agreement on the language of the Sturdy Act. We have done the legwork for you. Now I urge you to offer your full support for this life-saving bill. Thank you for hearing my testimony today.
Ms. McGee, thank you for your testimony and your courage in coming forward to talk not only today, but I know on many other days, to stand up for other children and to stand up for families. The fact that you're willing to share your son Ted's story, I know will give and continues to give inspiration to other families, but it's also helped us with policy changes and advancing legislation. So I want to thank you for that. I can't even begin to imagine what you and your family have lived through, but we're grateful to you for your willingness to be here today and on so many other days to help move this legislation forward. I know that just last night I was talking to one of my colleagues. You're one of your two home state senators, Senator Klobuchar, who has been working with us since the beginning of this legislation to move it forward. And I want to thank you for working with her and working with so many others to make this happen. As you said in your statement, you said that you hope that we could understand that my, quote, my voice is one of many, unquote. And that's true. And your voice and the voices of those families have not been fully heard yet, but they're about to be, because we're going to get this legislation passed. But I wanted to ask you just a basic question about the nature of the bill and why passage of the legislation is important. I know you've addressed that already in your statement, but what passage of this bill would mean to you and to the families you work with through Parents Against Tipovers?
Thank you for that question, Chairman Casey. For all of us parents and Pat, passing the Sturdy Act would be a huge milestone in the fight to finally stop tipovers. Some of the parents in our group have been advocating for tipover prevention for well over a decade, some almost two. And it would mean we finally will have a timeline for when we can expect to see more stable clothing storage units on the market. It would mean that we can finally rest knowing that all manufacturers are going to be held accountable to the new mandatory standard. So essentially, it will finally mean that we can see a light at the end of the tunnel.
Well, again, I want to thank you. And as you and others will know today, we've had a breakthrough recently to get agreements. So we're working with senators in both parties, and the House has already acted, as you know. But we're on a pathway. We're not done yet, but we're going to get there. But again, I want to thank you for that help. I wanted to turn in the remaining time that I have in this block of questions to Dr. Parake. As you know, it's estimated that a quarter of all adults ages 65 and older will fall each year. And as I mentioned, the death number that's related to these falls among seniors is 34,000 seniors pass away due to complications from falls every year. We know that most of the falls occur within the home. We also know that evidence-based programs can prevent the harms that result from these falls. I'm a co-sponsor of a piece of legislation introduced by Senator Angus King of Maine, the Preventative Home Visit Act, Senate Bill 2175, which would enable people with Medicare to receive personalized home and safety recommendations from a trained medical professional, and it may reduce falls. So, Doctor, in your written testimony, you state that, quote, housing is health, unquote. Why is it important for us to promote home safety for older adults?
Senator, thank you so much for that question. You know, I think the answer is this is an opportunity for all of us to save lives, reduce suffering, increase independence. The demographics warrant it with the rise of seniors, aging of the U.S. population, more seniors living alone, more seniors living in rural America, more seniors with disabilities needing long-term services and supports. Home modifications is just so critical to reduce injury and to save lives. And I think home modifications and falls prevention go together. Low cost, high impact home modifications can reduce falls. Community-based programs like Matter of Balance, which you alluded to, the Capable program, those can also reduce falls. And then there are things we can do in terms of clinically better screening and assessing individuals at high risk for falls. So the legislation that you mentioned I think that can be important, particularly having qualified providers like an occupational therapist, being able to assess inside the home individual who's high risk for falls. You can certainly see how that could reduce suffering, reduce falls, as well as save lives. So I think making sure we get the right qualified professional, making sure we focus on high risk individuals, and then connecting them with the home modifications they need, as well as the medical care they need, I think is critical.
Doctor, thanks very much. I'll turn next to Ranking Member Scott.
Thank you, Chairman Casey. Ms. Cleveland Leget, question for you as relates to achieving the American dream. It seems like the American dream is synonymous with home ownership, and the fact of the matter is, as we watch down payments, the value of a home goes up, therefore the value or the amount of the down payment also goes up. We see that without any question, seniors and families who struggle to afford a home seem to be heading in the same direction, higher and higher and higher. Can you talk about the critical role opportunity zones can play in expanding access to safe, affordable housing?
Yes, Senator. The opportunity zones can play an absolutely critical role. When you have the public and private partnerships, when you have private developers at the table trying to do what they can in order to increase housing, it makes a difference. I have seen it. I have seen housing that has come about through opportunity zones, allows people to live in a dignified location and a manner. And not only seniors, but non-seniors have housing now because of the opportunity zones and the investment that developers are willing to make into these communities. As I said earlier, the finding from the Nonpartisan Joint Committee found out that 24% of the $24 billion invested in opportunity zone funds went to low-income communities. And it's not just low-income communities. I've seen where they are invested in workforce housing. In a city like Birmingham, where there was an old factory and an opportunity zone developer came in, didn't tear it down, but revitalized it, and it became a beautiful workforce housing development. So housing is critical, and opportunity zones, it allows this to happen through developers who are allowed to invest and create new housing in these communities.
Thank you, ma'am. Another question for you. I served on county council in a prior life, it feels like at this point in my career. And in that life, I will say without any question, watching the zoning decisions and the land use restrictions that are sometimes placed from the local level, whether it's the municipal or the county levels, really does it does restrict the amount of homes on the market, so to speak. 39% of seniors say that an unaffordable housing is a major problem and a reality, and you can't have a safe home if you can't afford a home at all. Could you explain how land use regulations hurt the poorest and most vulnerable Americans, and what impact reforms like accessory dwelling units can have on vulnerable populations?
Yes, Senator. So zoning, which, as you've indicated, is a local issue. It's a state and municipal local issue. They make the zoning rules, but they can have long-term and wide-reaching effects. I've seen communities, and particularly when you're dealing with low income and even the homeless population, where you have restrictions on the type of dwellings that can go in a particular location. It does not allow certain multifamily housing to come up, which would be beneficial to seniors. And as I said, even the homeless population. So where cities where you see the homeless population burgeoning, which could include seniors who no longer have a place to dwell, are limited because of the zoning regulations that limit what kind of dwelling can be erected. So absolutely, and it would behoove us to reach out to our local communities, local decision makers to understand what wide-reaching effect their regulations have on the ability of individuals to sustain a life. Housing is critical for our seniors. Everyone is not in a position to have their relatives live with them, but the ADUs or accessory development units can be beneficial. That also is regulated locally. So
Thank you
where
very-
you can put them, what you can do, but for those of you who don't know what they are, they're basically additions in your home. So just say I have a house and I want my to widen my house and to create new housing for someone to come in and live. Those accessory dwelling units are permissible if the local legislators allow this to happen. And more, it's an option. If you've got the land, or if you can even rehabilitate your own existing house where you could create something, it could create an ADU as well. So things like that are important. Changing the regulations and also expanding the regulations so that they allow for ADUs in our communities.
Great. Thank you so much. Chairman Casey, I turn it back to you, sir.
Thank you, Ranking Member Scott. I know we're awaiting one or two senators right now, but in the interim, I'll get a question and then we'll transition as we go. I wanted to turn to Ms. Kelly regarding the work that you've done at Ikea. You made reference in your testimony to Ikea's Safer Life at Home initiative, focusing on safety and innovation. Part of this work includes Ikea's work to advance the legislation I made reference to, the Sturdy Act, and promote furniture stability. As you note in your testimony, Ikea believes the Sturdy Act promotes, quote, innovation and regulatory clarity, unquote, and is good for families and businesses alike. So I want to thank Ikea for the work you've done and the partnership on this effort. Here's a two-part question. What has driven Ikea's interest in leading by example on these product safety issues and innovation? That's kind of part one of the question. Part two is, why is it important for the industry more broadly to be involved in this kind of work?
Thank you, Chairman Casey. Our knowledge at Ikea about life at home and the resources that we have in product development and design, and our understanding of how customers engage lets us contribute to these topics, and in some cases we can lead. And as a major retailer and manufacturer, we feel that it's our responsibility to do that. We have a reach of millions of customers around the world. So when we decide to take action, we can actually make a meaningful difference. But while we continue to improve in our own business, we know that if we want to make change that's wider, that's industry-wide, then we need to work with other stakeholders. And we need to work with stakeholders who are leaders in this area. And we believe that the best solutions happen when you bring together a diverse group with different perspectives, sometimes unlikely groups of people and organizations, but with a common goal. And we believe that as a business, we have an important perspective to bring to these conversations, and that by working together, we can come to solutions that work to promote safety, but at the same time, work for business. Thank you.
Ms. Kelly, thanks very much. Wanted to turn to our next senator, but I also want to acknowledge that Senator Warnock has joined us, and I'll now turn to Senator Gillibrand.
Thank you so much, Mr. Chairman. In comparison to the population at large, starting at age 65, older Americans are more than twice as likely to be killed or injured by fires. Many older Americans experience poor eyesight, loss of hearing, arthritis, dementia, and side effects from medicine that can make it difficult to react to a fire. I've introduced legislation, the Housing Temperature Safety Act, which would require the installation of heat sensors in federally subsidized housing. I'm also a co-sponsor of the Public Housing Fire Safety Act, which would provide funding for public housing agencies to install automatic sprinkler systems. Dr. Parake, what impact would require further installations of fire prevention mechanisms such as heat sensors and sprinklers have on older Americans? And second, do you believe it would be significantly and meaningfully helpful to increase the safety of older Americans towards housing fire dangers?
Senator Gillibrand, thank you for that question and this important public health issue. I think certainly there is data to support automatic sprinkler systems. Heat sensors also can be a sensitive way to detect fires. So I do think that these interventions should be looked at. Certainly the feasibility, the cost studied as well. I will also say that more broadly in terms of fire prevention, if you look at older adults, the most common cause of home fire deaths in the elderly still is smoking. So smoking cessation, I think, is critical here, ensuring that there are smoke alarms, battery operated, ensuring that there's cooking safety, space heater safety, the use of space heaters, all of these prevention tools, in addition to the interventions that you're articulating, I think could make a big difference in reducing fire deaths in the elderly population.
Most older adults prefer to remain in their homes and communities as they age, yet many older adults face significant challenges to safety and independence because of modifiable risk factors in their homes. Unintentional home injuries cause more than 30,000 deaths and 12 million non-fatal injuries annually in the United States. Home improvements, modifications, and repairs can enhance home accessibility over a person's lifespan and reduce the risk of unintentional injuries. These improvements may include addressing unsafe furniture or appliances or supporting balance to reduce risk of falls. For Ms. McGee, thank you for sharing your story. I know that it cannot be easy, but I appreciate you bringing the awareness to this issue. You mentioned the STURDY Act as a piece of legislation that would help prevent injuries and harm from furniture tipping over. Can you please describe the standards this legislation would set to stabilize furniture and how it would help prevent dangerous incidences of future furniture tipping?
Absolutely. Thank you for this question, Senator. As many people on the call know, the Consumer Product Safety Commission released an NPR last year after 4+ years of investigating the tip over issue. And their 1,200-page document was a lot to read, but it does say one thing very clearly, and that is that the current safety standard is woefully inadequate. We as parents already knew this. We knew of units that meet today's safety standards that have fallen over. We actually have a parent in our group who lost her son in 2017 from a dresser that meets today's safety standard and is still being sold in stores today. We know that change is coming. Manufacturers know change is coming. We stakeholders are all in agreement that STURDY is the best way to get this done. The STURDY Act requirements would hold manufacturers accountable, not only because it would be a mandatory standard rather than voluntary, but also because it would test for those real world use scenarios that I had mentioned that are not being tested for today. So dressers being loaded with clothes, which is how we use them, multiple drawers being open at once, dressers being used on carpeted surfaces, and the dynamic force being put on dressers during real use scenarios.
Yep. Well, thank you very much. And thank you, Mr. Chairman, for this important hearing.
Thank you, Senator Gillibrand. We'll next turn to Senator Braun.
Thank you, Mr. Chairman. I have had a lot of interaction with builders back in Indiana, and their main concern, in fact, one that's trying to find that sweet spot of where you abide by the regulations, but still can build something affordable, whether it's regular housing, elderly, kind of low income housing. I would be interested to hear from each panelist each witness what the one or two regulations out there that you most often hear about that well-intended but cause a disproportionate amount of expense and cost. And I can think of one related to WOTUS, and I'm one that's very sensitive about taking care of the environment. But in talking to developers, that constantly was an issue that could raise the cost of any development. But I'd like to start with Ms. Cleveland Leget, and let's go through to where each of you take maybe a minute or so and tell me what you hear most often, the regulations that need to be maybe changed that would give us the biggest bang for our buck to find a sweeter spot, especially on individual housing, but I think it would apply across the board. Go ahead, Ms. Cleveland Leget, start off.
Yes, there's not a specific regulation that comes to mind, but I do think it is so critical that there be public-private partnerships involved. One of the things that most developers that do low-income housing, they talk about the tax credits. That's something that is issued by the Treasury Department and ultimately utilized and distributed by the states. So each state is allocated a certain number of tax credits. And that is a must in developing low-income housing. They need those tax credits. So that's not really a regulation, but it is a necessary component to developing low-income housing. I believe that putting our minds together, that one of the things that we've been able to do in the past is work together to come up with what works. There are some situations where it doesn't necessarily work, but most developers who are in this space have come up with ways to make it work. And that primary way is through low-income tax credits.
Well, thank you there. And we've got about maybe 30 to 40 seconds for the other witnesses to chime in as well. Go ahead.
Well, I'll just say very briefly, Senator, our Senior Health and Housing Task Force at the Bipartisan Policy Center was very much in support of the low-income housing tax credit, and also made a recommendation in line with what Ms. Cleveland Leget talked about reforming zoning laws to allow for accessory dwelling units. The long and short of it is that seniors, there is a dearth of affordable housing out there, and we need to look at all ways where we can ensure that seniors have accessible, affordable housing. And looking at those zoning laws locally, I think, is one path forward.
Anyone else want to weigh in? Well, if not, I think that whenever you're looking at regulations, zoning, ordinances, there's always, I think, the lack of maybe trying to quantify how much that actually costs. But it all gets in kind of a nebulous way built into the cost of trying to get what we're after, something that's more practical to make it affordable. So I think that most agencies know that it adds to the cost, never take the time to maybe figure out exactly how much that is per square foot. I think it'd be smart to do, because a lot of what I hear in terms of getting the sweet spot, especially on entry-level single family homes, it's about $30,000 to $40,000 away from where it should be. And in many instances, they think about half of that cost could be due to regulations that they're uncertain the value to, say, the eventual homeowner or the process, and that there needs to be more attention paid on actually, when we do regulate, what it costs even per board foot. So observation, hear it a lot out in the field, and thanks for taking the time to respond to the question. Appreciate it.
Thank you, Senator Braun. And before moving to our next senator, I want to acknowledge Senator Kelly joined the hearing. And now we'll turn to Senator Rosen.
Well, thank you, Chairman Casey, and I'm not in the room. Ranking Member Scott, if you're there, thank you as well for holding, of course, this really important hearing. And the witnesses, thank you all for being here today. We really appreciate you. And, I just want to talk a little bit about enhancing assistive technology for seniors at home. We know it's important to age in place, and we're increasingly seeing the benefits of new and innovative technology changing the way seniors are living, aging at home. Technology offers greater security and independence for seniors, ultimately really preserving their quality of life. In Nevada, we're helping to lead the way in some of this innovative work. For example, in 2017, members of UNLV's student engineering team won first place in the Department of Energy competition when they worked directly with Nevada seniors to build a home designed to help older adults age in place, powered entirely by solar energy with smart homes and health monitoring technologies. So, Dr. Parake, as a clinician and a public health expert, how do you think we can best adapt the existing technology we have, upgrade it however we need to meet the needs of seniors, older adults, or as we age in place in our own home, how can we continue to upgrade?
Senator, thank you for that question. Congratulations to the UNLV team. And certainly technology is a solution here. I think we have to meet seniors where they are, and realizing that many seniors may have vision or balance or movement challenges. I think technologies that are easy to use, user-friendly, that they can see, they can interface with their healthcare provider or others, I think are going to be absolutely critical. There are so many technologies out there. So also ensuring that we have research so that we know which of these interventions and technologies lead to the best outcomes, I think is really important. Broadband is absolutely going to be critical as well here. And then we need to increase awareness of those technologies, ensure that they're accessible. That could be reimbursement through insurance, or that could be through tax credits or grants in the private sector taking the lead. So I think there are a number of things here. We've got to make them user-friendly. Got to make sure the research is there, make sure that there's awareness, and make sure, particularly for low-income Americans, that the public and private sector are supporting access to them.
That's great. I want to build on that because I stepped away from my career to take care of my parents and in-laws. And so I want to be sure that we have to ensure that families caring for their aging relatives like I did have access. They're aware about the new technologies. You talked about broadband. It's particularly important for low-income families and for telehealth for those families that don't have easy access to healthcare providers. So do you have any other ideas about what more we can do to help the caregivers and ensure that families have access to healthcare?
Well, I think that the telehealth piece is so critical. We've seen the importance of telemedicine during this pandemic. Remote monitoring technologies are so important as well. There are many consumer-facing apps that are evidence-based that promote self-management. So I think we have to continue pushing the envelope on telehealth. And I would say it's not only important from a direct health perspective, but Senator, we're also facing a significant public health challenge in this country of social isolation and loneliness amongst elders. Social isolation increases mortality by 29%, increases the risk of chronic conditions, leads to costs for the Medicare program. So connectivity through broadband, connecting seniors, loved ones with family, friends, the resources, supports they need, I think are going to be so critical moving forward.
Well, I'm actually glad you brought that up because that was actually my next question was senior isolation and some of the safety issues around senior isolation, like preventing falls. So you set me right up for the next question because falls are the leading safety concern for older Americans. A quarter of people age 65 and older fall each year, millions of visits to the emergency room, 34,000 deaths among adults aged 65 years and older annually from falls. And so again, we also know COVID, seniors were so isolated. It really has an impact on your mental health and then your physical health. So I'm curious to learn a little bit more about the creative ways communities are responding that you think to prevent falls in the home and also to address the social isolation. So how do you think, have you seen some research or what can we do to be sure that we increase the safety from falls specifically and really try to decrease that feeling of social isolation?
Yeah, I think the most important thing we can do is to support seniors in ensuring that they're physically active and that they're seen and can be seen. The best data I've seen is from the National Poll on Healthy Aging out of the University of Michigan. And it does appear that during the pandemic, more seniors were less active. Their physical conditioning decreased. They experienced more falls. This was more common in women and those who lack companionship. So all of this social isolation, falls, they're all connected. I don't know how families have mitigated this, but my hypothesis, Senator, would be that what we need to do is ensure that they feel connected, that they're seen, that they're visited, and they're engaged physically. Physical activity is also critical to reducing falls.
Well, this is where improving access to broadband and telemedicine and visitation, community, other kinds of engagement really important. Thank you so much. I yield back.
Senator Rosen, thanks very much for your questions. I'll turn next to Ranking Member Scott.
Thank you, Mr. Chairman. What an interesting hearing, by the way. And I think our panelists are doing a really good job of distilling some of the important issues from healthcare to housing that we all see our seniors facing and looking for ways to overcome them. So thank you very much for holding this hearing, and so thankful for the panelists for bringing your expertise to bear against a very important issue. Ms. Cleveland Leget, seniors are a growing share of the housing market as our population ages. I think you said something that caught my attention, that 1 out of 5 Americans in the years coming will be seniors. I have also heard statistics that we are on the verge of having more seniors than people becoming seniors than we have births in our nation. That is a challenge for a nation that's not yet replacing ourselves. So we have a lot of work that needs to be done. The private sector is increasingly recognizing the trend in the aging of our population. Some companies are starting to offer expanded home modification and assistive technology services and expertise. Could you help us understand the role of the private sector and innovative small businesses in meeting seniors' housing needs?
The private sector is critical for a number of different reasons. The public sector does not have the financial wherewithal to bear the burden by itself. You've got HUD, you've got HHS, you've got the VA with VASH vouchers, you've got other federal organizations. However, alone, they can't bear the burden. And so it is a necessary component. The private sector is critical, not only for innovation, but also their dollars. Them putting forth the backbone, the backup financially, and then bringing that to the table, because the private sector dollars coupled with the public sector dollars makes a difference. I've seen from organizations that come to play with public dollars with the Choice Neighborhood Grants, $30 million. Sounds like a lot of money. But when you start building and putting together the kind of communities that we need, the $30 million in a Choice Neighborhood Grant is also enhanced when you've got a private developer coming in and adding to that financially and adding their ability to put together innovative of housing. So the private sector is critical. We cannot continue and we cannot develop the way that we want to just on government funding. It really won't work. And I've seen it time and time again in the places that I've visited, and it's critical. From every state that I've oversaw to Puerto Rico to the USVI, it is absolutely an essential component to have the private sector as partners in this. And as I said earlier, what are some of the things that brings them to the table? Bringing them to the table are the tax credits. That helps them pencil out, that helps them make sense of what they want to do. because of course, they're there to, they're not nonprofit, so they're there to, you know, to make money, which is not a bad thing. However, many of them have come to the table with the right mission. That's why I am with Integral, because of their mission. They're mission oriented. Yes, they are a private developer, but they've also incorporated in their mission that they are going to change the trajectory of the lives of the people that they serve, whether it's elderly, whether it's low income, no matter who it is. And there are other developers who've done that. But in my estimation, no one has done it as well as Integral.
Thank you very much for the answer. And Ms. Chairman, I'll certainly have questions for another round, perhaps depending on time. I will use my last 10 seconds to just acknowledge the fact that when you think about public housing for our seniors, the backlog for repairs is over $70 billion. So we have a lot of work that needs to be done to make sure that even accessible and safe public housing is up to code for our seniors, so to speak. Thank you for the time.
Ranking Member Scott, thanks very much for your questions in the second round. We're going to have to conclude, but I wanted to just have some closing comments before turning again to the ranking member. Today in this hearing, our witnesses helped us better understand both health and safety issues within the home. Our witnesses, of course, and we're grateful for their testimony and their presence today. Our witnesses demonstrated that Congress must do more to prevent tragedies caused by unintentional home injuries. I believe we must support older adults aging safely in their homes through passage of bills like the Preventative Home Visit Act. I mentioned earlier Senator King's legislation. We learned that falls can be prevented through common sense and cost-effective home modifications and evidence-based programs. We also have to ensure that furniture sold to consumers is tested for both safety and stability. I believe we owe this to children like Teddy McGee, Katie Lambert, Karen Collis, and so many other children, and to their families, and to every family who has lost a loved one from a preventable injury like a fall or a furniture tip over, whether that individual is a child or a senior. So this starts with passage of the Bipartisan Sturdy Act, a bill that will save children's lives. As Ms. McGee noted in her testimony, a coalition of consumer groups, parents, and industry partners have come to an agreement on advancing the Sturdy Act legislation. They've done the hard work for us all these months, longer than months now, working on an agreement. So now it's time for the Senate to take on its responsibility to ensure that our homes are safe. So I'll turn next to Ranking Member Scott for his closing remarks.
Let me just thank each and every person who provided testimony in today's hearing. So valuable was the testimonies that we've heard. The answers to the questions provided more light into solutions. I am always a fan of public-private partnerships to meet the problems and the challenges of this country, especially in the housing area. I think we heard excellent testimony, heart-wrenching testimony around the challenges of falls and furniture falling on kids particularly, and overall falls by seniors, more than 36,000 a year. You all provided us a number of solutions. Also want to note the fact that the use of virtual health or telemedicine is becoming an important part of senior living, and one that we should all be excited about, and look forward to having more hearings and more discussions around providing excellent quality health care without seniors having to necessarily drive to appointments, but having the opportunity to have those appointments from where they live. And in fact, as we think about where they live, making sure that affordable, safe housing is a part of the primary responsibility as we think about the golden years of our seniors would be an incredibly important part of the engagement. Thank you all for being here. And Mr. Chairman, I yield back.
Ranking Member Scott, thanks very much. And I want to note for the record that we may have set a record this month. We've had 3 committee hearings. So I want to thank Ranking Member Scott for his work and his cooperation, as well as the staffs of both of our teams, all the hours that they put in to have 3 hearings in a month. Ranking Member Scott, I think it's a record, but it's probably not a record we want to set every month. But I'm grateful.
Let's not. Some records should lie. They should stay set forever.
But it is we're grateful for all the work that they did.
Indeed.
And for today's hearing, I want to once again thank all of our witnesses for contributing both their time and their expertise and their personal experiences that bring to bear on so many of these issues that involve safety. For the record, if any senator has additional questions for witnesses or statements to be added to the record, the hearing record will be kept open for 7 days until next Thursday, April the 7th. So thank you again, everyone, for participating. This concludes today's hearing.